Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, has called for a gradual end to Nigeria's dependence on foreign aid in funding its response to HIV/AIDS, tuberculosis, and malaria, as the House of Representatives began an investigative hearing into over $4.6 billion in grants received from the Global Fund and USAID between 2021 and 2025. At the hearing by the House Committee on Infectious Diseases in Abuja, Professor Pate emphasized that Nigeria must take greater responsibility for funding its health priorities as donor support declines after 2 decades of assistance. He welcomed the probe as a positive step toward enhancing transparency, accountability, and domestic ownership of health programs, and noted that while donor funding has saved millions of lives through interventions targeting HIV, tuberculosis, and malaria, Nigeria's health spending still falls below 15% of the Abuja Declaration target. He warned that continued underfunding could threaten the sustainability of the country's health initiatives.
The fraud prevention, we have zero tolerance policy on fraud, and any anomalies that are flagged are promptly flagged for investigation and recovery, including whistleblowers. The sustainability angle is also paramount in our mind, with our transition plan to integrate the Global Fund and US government supported programs into our own national programs so that we exit from the dependency, and to facilitate local manufacturing of commodities so that much of these commodities will not be brought from abroad, but that we produce them locally. Over 20-something years, we have just been receiving what is produced elsewhere. But to sustain the momentum, we urge the committee, as we go through this exercise, to serve as our advocate for increasing domestic investments through the appropriation process.
Speaker of the House, Honorable Tajuddin Abbas, represented by Honorable Ibrahim Isiaka, stated the investigation underscores Parliament's commitment to ensuring transparency in health funding. He explained the inquiry will produce an evidence-based report detailing how grants were received, utilized, and their impact on public health, while also strengthening accountability and governance within the sector.
And the expected outcomes are a comprehensive evidence-based report detailing how the grants were received, how they were utilized, and what impacts were achieved, and where gaps or inefficiencies may exist, if any. Recommendations to strengthen governance, financial management, procurement, monitoring and evaluation, and accountability frameworks for health funding. A pathway to sustaining resilient health systems that can better prevent, detect, and respond to HIV, TB, and malaria, while protecting vulnerable populations and advancing universal health coverage.
Committee Chairman Honorable Amu Bioga added the investigation will examine fund management and ensure that all implementation partners fully account for the resources they received.
We are aware that the grants received from international partners and donors agencies before now form 90% of the country's intervention and investment in the response against these diseases. Henceforth, we cannot continue to receive grants and aids that reduces us as mere spectators, while the donors' countries spearhead the management and administration of those grants indirectly. We should call a spade by its name. Any grant or assistance being given to us without us managing such grant is unacceptable.